Thank you so much. Zoe, I don't know if I should start calling you Zoe. That might be the bougie new you. I know you as Zoe, so that's what I'm going to say. If that's it. Good
It's
morning.
either one.
And thank you for having us back. Last time I mentioned at the end, and I'll say this again for anyone who's interested, and I've got a slide that's got all my contact information up that we'll put up at the end too. But I did offer to meet with, speak with, get together with anyone individually or as a group after this. And I had several people reach out to me. I think I may have inadvertently missed some people. I did get a lot of responses that day. So please, if I didn't contact you, it was just an oversight, and I'll um, please reach back out to me again. So let's do a share. I did make up a PowerPoint for us. And hang on a second here. Do it from the presenter mode if possible. You seeing that in presenter mode, guys? Or are you seeing?
Yes, we see.
Yep, it looks great, Kimble.
Okay. The information is not technically coming from IPLA. I think that it's good information, and I believe that it's accurate, but I am not an IPLA employee, as you already know. They are aware I'm giving this presentation. I did meet with them just yesterday to go over it to make sure that from their perspective it was accurate. And I will say that I've always found the board to be friendly, to want to collaborate, even the board staff, especially. But it is difficult to, I think, sometimes connect, unfortunately. So thank you for having us on again. By way of education a bit, just to bring us all together again, what is the agency? What is the board? What are the different sections and the different licenses? So the agency is a state agency. It used to be two separate ones. Those of us who are old enough will remember that there used to be something called the Health Services Board, or the Health Professions Bureau is what it was called technically, Health Professions Bureau, and that was any clinical license separate from the professional licensing agency, which were things like architects, cosmetology, anything that was non-clinical. And then probably 10, 15 years ago, they combined it together. One of the boards, as you know, is the Behavioral Health and Human Services Board, which is akin to, we are brothers and sisters with the Psychology Board, but we are separate. Interestingly, the board director and assistant director are the same. So they have both boards to manage. We are what we call in the United States a composite board, which means we have different sections. Some states manage each profession separately. Indiana likes to be cost savings. We don't like to be regulated so much, but in this case, there were 4 sections that got together at some point. So if you ever want me to come back and tell you about the history of how the board happened and everything that happened since the 1980s forward, happy to do that. I lived through it, and I know some of the details there. Anyway, we have 11 licenses that we manage. Those have come on over the years. Licensure began in 1998. Currently, we have, as of Sunday, just over 18,000 professionals licensed by our board. And this is the breakdown. Now, this is not 18,000 separate individual people, because there are some of us still who have more than one license. I think the people who have dual licenses will continue, and it mostly is addictions plus something else at this point. But um, others of us who were there from the beginning probably got some of our licenses via a grandparenting period. Let's get to it, y'all. What might be some reasons for application delays? So I put up some things that I thought were reasons. The board staff, Cindy and Dana, who are director and assistant director, added some of theirs, and we came up with this list together for you guys. This is not an exhaustive list, and it's not really particularly in order, but it was how we sort of thought of things. Okay, so sometimes when people upload their information to their licensure portal, they believe that I'm going to send in everything that I have to cover it all. And that literally bogs down their wait time, because that means staff have to go through it all and figure out, is this something that's needed in their file or not, or in their application? Sometimes people send in actual practicum and internship hour logs. We don't need that. They'll send in all of their certificates that they've ever gotten in their career. Sometimes their CEU credits. We don't need those, ironically, unless those are needed for other reasons. They'll send a resume. None of that is necessary, but people send it in. Oftentimes people will, everybody, when you submit an application, has to fill out, typically on most sections, this is called Form C, is in coursework. And you have to fill out, each of the licenses require different kinds of coursework that have to be fulfilled. For some of the board, you can see that we have things that cover all 4 sections, and some are very specific. Education is very specific to each section of the board. And in some cases, you have to have a specific class to cover a content area. In other cases, you have to just have the content area covered somehow in your program. People will put in courses in all kind of funky ways, and technically, if you put in a wrong class for the wrong course, technically it could just be marked, this is wrong, and it gets sent back to you. I think most people on the board are really try to be helpful and friendly. I'm saying this with Martin in mind, because Martin and I represent the mental health counselor section in particular, and he and I work very closely on file reviews, and we'll look at a person's transcripts, we'll figure it out for them if we think that they didn't fill it out correctly, and we'll try to correct it on their behalf. But that does slow it down. And we are trying to work with the schools directly to say, tell us where you think courses fit, and we'll tell you if we think, let's see if we can come to a consensus. It's not wrong to work many different places. It's not wrong to have lots of supervisors, but frankly, it slows the process down. So when you have dates that overlap, when you have times and hours that overlap, it's difficult for people to figure out, well, where does one thing start and one thing end? If you overlap by a month or two somewhere, you can't, you know what I mean? You can't count those months separately. They have to count together. We're trying to redo some of the paperwork so that it makes it a little more obvious where you have to sign. But not everybody has their paper signed appropriately. Not everybody puts dates in. And again, when you do that, it creates a lag, and we have to go back and tell you, hey, you're missing these dates, then you have to go back and fill it in and send it back in. And interested. This doesn't happen very often, but every once in a while, somebody will put down a supervisor who doesn't have the appropriate credentials for the section of licensee that they're supposed to get. So this often happens when we get people that worked in a school. For example, they were working in a school counselor capacity. They want to come back and be licensed, not necessarily only through the Department of Education, but also through our board, and say, well, I was supervised by my principal. Okay, that's not wrong. You absolutely can be supervised by your principal, but not for counting hours for this board's sake. Even a school psychologist doesn't count in some capacities. So you have to really know what that is. Now, people get nervous. I understand that. They send in their paperwork. They don't hear anything from the board. And then they're like, oh no, did they get my paperwork? I don't care. I'm just going to send it in to make sure. Every time people send in paperwork, it has to be reviewed. And so sometimes that slows it down. This really just goes to what we were talking about with having multiple supervisors and multiple employers. Sometimes things don't add up and you have to go back and say, okay, what was the start and stop date on this employment? And it's okay if they overlap. It's just we have to figure out the start and stop times. Interestingly, people try to send in transcripts before they actually have a degree and conferred date that's listed on there. People will try to send us their diplomas. It's nice to see them, but we don't need them. It's one of those extras. So send in your transcripts only. Martin or Katie, anything you want to add to this list?
I don't think so. Looks good.
Okay. Now, Zoe asked for 10. What does Kimble do for Zoe? He goes above and beyond. So I'm giving you more than you even asked for. You ready? What happens when someone has what we call a yes or no response? When you fill out, and all of you have done this, even our good doctor on there, you have to send our MD doctor, shall I say, you had to apply for your medical license, and there are a series of questions that you have to answer. Some of which are, have you ever been arrested? Other than a minor traffic offense, for example. And what we call this in licensure language, we call it a positive response. Positive doesn't necessarily mean good. It just means that you've answered yes to one or more of the questions. And a yes response means we need to get some information from you about what happened. Every once in a while, someone will say, no, I haven't been arrested, but guess what happens when they get their criminal background check? Something comes back on it. And so then that's another issue that we have to address. What should we do as a board if they've said, no, I've never been arrested, but in fact they have? So that every single month, folks, that is an issue that comes up for the board. People make mistakes, and you can get, unless there are certain levels of a felony, you can get your record expunged in most cases. Expunged means it shows up that it never happened. And you can answer, no, I've never been arrested if you have an expungement. Sometimes people don't understand what that means. And they'll say no and say, well, I thought it was expunged. Every once in a while, even if something is expunged, it will show up either on your state or your FBI background, and you have to simply send in your expungement order, and that's okay. Otherwise, sometimes people will have their issues dismissed. That means you still were arrested, but the court decided not to act on the charges. But you still have to answer, yes, I was arrested. The criminal background check that the state of Indiana does is very thorough, and people seem to be surprised by it because they're like, well, I've worked for the Department of Child Services. I've had background checks before. Nothing ever came up. But when I applied for a state license, something came up on my background. And it doesn't have an end date to it. In other words, you think, well, I did something when I was, in my teens or early 20s. That was like 40 years ago. I should be good to go. It looks for all of that. If you have something, what we call a positive response or a yes response in your background, you have to upload the court documents and an explanation about what happened. We want you to be specific. Sometimes we get explanations that say, on January 1st, 2021, I had a DUI, period. And that's what we get. We're like, let's have a little bit more than that. Now, sometimes we get things that are like 3 to 5 single-spaced pages. Okay, we don't probably need all that much details, but somewhere in between would be good. Periodically, things that happened a long time ago, the courts literally don't have the records. That's okay. You just need to get a letter sent in that says the information is no longer available or they have no more records of it. That's fine.
Kimble, before you move on, I did receive a question about the history behind the associate permit. For example, the LMCA versus the LMHC, and sometimes that causes some confusion. Is that something you could highlight?
Let me try to do it in 5 minutes. Do I have 5 minutes?
You have 5 minutes, yes.
Oh, Kimble Richardson part 3, I think.
Okay.
I'm sorry, guys, but it is, as you already know, it's dense information. It's not super mind-blowing and it's not math really, but it's a lot and it's a lot to do. It takes about 10 days for the board staff to review your information. So if you get nervous and you're like, oh, I don't know if they received my information, you start sending it again and again, it bogs it down. So wait to get your information. Don't send it via email, send it in via your portal. If a supervisor is willing to do this, frankly, it would be helpful just to have one form if they're willing to do it. If not, go ahead and send them all in. If you need to resend something in, you have to send a new form, upload a new form with new dates and a new signature. We get things where people cross out dates, mark them out, even put their initials by it. That's not okay. It could be considered fraudulent. Zoe already knows because of some recent legislative changes, we have some fixes for people to get through the process a little quicker. It's called early exams. People can take an exam prior to graduation. You send in, you fill out an application, you send in $50 and send in a get from your university. The university doesn't have to put it in your portal. You can put it in yourself. And that is what a letter of good standing means. And I can send this PowerPoint to you, Zoe, too, that you can send out to everybody. This is how there isn't anything called an early exam application per se. You simply fill out the application for the license you want to have. We already know you're not going to be able to fill out everything. That's okay. You'll get a letter back that says, hey, you need X, Y, and Z, but we're going to give you permission to take the exam. Let me get to the issue about temporary permits. A temporary permit acts the same as a license, but it's called a temporary permit so that people aren't confused that it's your actual license. It allows you to practice while you're waiting to take an exam. Okay, it allows you to practice while you're waiting to take the exam. A temporary permit is only granted if you ask for it. First of all, it's not just automatically given. You have to request it, and it is an extra $25. That said, guys, our state has probably the lowest licensure fee for behavioral health professionals in the country. It's $50. Now, I know when I was a graduate student, $50 meant $1,000, but other states are more like $1 to $350. I thought I saw as the highest. I know medical licenses are more than that. So you can request a temporary permit for an A license, and it's granted for 1 year. You have 1 year to take your exam. If you're smart, you'll take it early, because if you don't pass it the first time, which is okay, you'll have extra time to take it again. You probably could squeeze in 3 attempts in 1 year if you need to. You can also request a temporary permit for a clinical level license. That's good for 6 months, because you have 6 months to take that clinical license. The recent House Bill 1138 did not allow, and you'll understand this, it'll make sense to you here in a minute, did not allow for people to get a temporary permit when you were requesting to take an early exam. You can't get a temporary permit because what that does is gives you a license to practice. So you're taking an early exam, which means you're still in school, you haven't yet graduated. Okay, doesn't it make sense now? So we're not giving you a license to practice, we're just giving you permission to take your exam early. Some people say, I don't want to take it early. I want to get a temporary permit. I want to have wiggle room to get my life in order, to be free of not being in school for a minute, to study and do all the things, and then take it after I graduate. But just so you see this, I have information up here about what to do about reapplications. I know we're running out of time, and my contact information for you. So
Oh, we probably do need a part 3. Yeah. So you'll be my only 3-time guest on the Cup of Joe. So, and I just really want to thank you. This was super beneficial. I think these slides will be extremely helpful. And you guys, Kimble and Martin, the board does this as a volunteer of their time. And the amount of hours that goes into reviewing this is really extensive. And so I'm just so grateful that Kimble even provides this education to help all of us with the licensing process. But before we wrap up, I want to make sure, are there any questions that anybody wants to ask that they did not get addressed during this session? I know it was a lot super fast. So if you think of any, you can send them my way. Kimble is a direct call a friend line. Yes, Ms. Henshaw, I see you have a question. Do you want to ask it? Is there something called a little a and a big A? Now I can't hear you, Kimble. No, uh-oh. There you are. There are a little a and a big A. Nope. You went out again. Okay, must be. Martin, do you want to answer that, little a or big A?
Sorry, I didn't see the question.
The question is, there's something called a little a and a big A as it relates to
No.
associate permits? No. Okay. So I'm reading Kimble's sign language. No, there is not. Okay. Any other questions?
So this is Steve. I think it may be helpful for part 3 to address what, as there's more emphasis on people with lived experience, we're going to see more and more people, I think, applying for licensure who are going to have a positive on the criminal background. I'd be more interested to hear the process the board goes through to, and the outcomes that they come to. Is it fairly subjective after they process the story, or are there some objective standards to give those individuals a green light on proceeding, or a red light and saying, no, we're not going to have you in this profession?
I will say, if I could just say very quickly, we are incredibly gracious, and I can't think of any situation where we've said to someone, we're not going to allow you to practice in the field. We're interested in hearing their story. We're interested in understanding their current plan of recovery.
Yeah, so we could, I'm building a part 3 as we speak, so we can add that, Steve. And then Laura, your question is just confirming that you cannot practice in any setting without a licensure, but this could be the TP. And I'm reading Kimble's sign language saying, no, that is not cool, and Martin's face as well. So that is confirmation there as well. So since we are at time, if you have any other questions that did not get answered or any other thoughts for part 3, please reach out to me. Just a couple save the dates because it's coming up very quickly. Registration for our conference in October, which will be focused on all things CCBHC related. The 9th, 10th, and 11th in Bloomington will be going out this week. August 20th, a number of you received an invitation from the state. It was invite only for the state mental health conference, and it is focused on CCBHC and crisis for state legislators, county commissioners, and key stakeholders. I'm grateful for the state because our community mental health system is the one that is leading these discussions. And so we have people from all over the state to share their expertise, and it will be a seed that will help us for our budget request and being able to advocate. So the timing couldn't be better. So August 20th is that. I look forward to seeing a number of you there. August 26th is open office hours with me, where you can get several of the updates I wasn't able to share today. And then September 10th, my guest for Cup of Joe will be our HRSA Region 5 representative. There are a number of workforce-related grants and resources that I learned from Amanda that I would love to share with all of you. And so that's our save the day. And then our Starbucks winner today is Sonia at Regional. So congratulations, Sonia, for that. We are going to raise our cups and thank our friends, Kimble and Martin, for helping, and appreciate all of you. We will do a part 3 on this. And so everyone have a fantastic Tuesday. Appreciate all of you. Thank you so much.